Hello everyone, this is the channel of New York City News. The headline news now. COVID-19 environmental transmission and preventive public health measures. August 24, 2020. With new COVID-19 cases decreased to very low levels in most parts of Australia, although persisting in a number of hotspots, mainly in the state of Victoria, and increasing in some other countries such as Brazil, it is time to reflect on the effectiveness and unintended consequences of public health measures taken so far at home and overseas to prevent transmission, and to identify challenges ahead. Extensive testing, contact tracing, and individual case and community containment, in addition to travel bans and social distancing, have largely succeeded in curbing COVID-19 infections in Australia. Strict lockdowns prevented widespread community transmission, albeit at very high economic cost. The imposed restrictions changed daily activity patterns and behaviors that also brought improvements in other areas. Greenhouse gas emissions declined, and ambient air and potentially surface water quality improved in many cities, mainly because of reduced road traffic and industrial activity. Influenza cases were suppressed as a result of social distancing, better hand hygiene and homeschooling. Some of these changes are likely to be transient, as economic and social activities are progressively increasing in most areas. However, we can draw some important public health learnings from the response to the pandemic that will help us reduce the risk of a resurgence of COVID-19 and strengthen disease prevention against a whole range of other pathogens in the long term. Environmental transmission pathways. A better understanding of the environmental transmission pathways of COVID-19 can focus the attention of public health units on the most effective prevention methods and, importantly, reduce the risk of community transmission in different settings. Although our current knowledge of the disease and the virus that causes it, SARS-CoV-2, is still evolving, we can learn from past coronavirus outbreaks such as the severe acute respiratory syndrome, SARS-1 and the Middle East respiratory syndrome, MERS-2 outbreaks, and from the course of the current pandemic in Australia and other countries. Most coronaviruses are transmitted via respiratory droplets through the mucosal or direct inhalation route and are manifested as respiratory diseases. However, human coronaviruses show environmental resistance that makes transmission via surfaces, hands, air, water, waste and food plausible. 3 In the SARS epidemic, transmission mainly occurred through direct physical contact with infected patients or by respiratory droplets spread over relatively close distances. 4 There were also a number of well-documented clusters of infection, which led to speculation about other possible transmission pathways, including contaminated air, sewage and surfaces, 5-7 and animal vectors. 8 The main transmission route of COVID-19 is thought to be via the spread of respiratory droplets from coughs and sneezes and direct contact with contaminated surfaces. However, emerging evidence suggests that airborne transmission via the spread of smaller particles, called aerosols, from exhaled air is also possible, especially indoors. 9-12 How far droplets and aerosols can spread depends on their size, as well as on the velocity of the respiratory jet, from coughing, sneezing, talking and breathing, and the temperature, humidity and flow of surrounding air. 13-14 Current evidence suggests that larger, 5 microns, respiratory droplets released by coughs or sneezes settle gravitationally close to the infected individual, within approximately 1 meter. Smaller droplets, less than or equal to 5 microns, evaporate quickly in the air forming very small particles, called droplet nuclei, that can travel longer distances. There is currently limited experimental evidence on how far these particles can travel and whether they can transmit COVID-19 under typical environmental conditions, although this is theoretically possible. 10, 11, 15, 16 A recent literature review has indicated that transmission of viruses is lower with physical distancing of 1 meter or more, with protection increasing as distances lengthened. 17 Evidence of substantial airborne transmission of COVID-19 can have profound consequences for health protection and would potentially require additional precautions, such as increased air ventilation in indoor spaces and wider community use of face masks, to reduce the risk of infection. 18, 19 The mode of transmission could also determine whether an infection starts in the upper or lower respiratory tract, which is thought to affect the severity of the disease progression. 18 The effectiveness of face masks in blocking droplets and aerosols depends on the type of mask and facial fit, and the size of the aerosols. Masks rated N95 or similar are effective in blocking aerosols of at least 0.3 microns in diameter when well fitted around the mouth and nose. Surgical masks fit loosely around the mouth and nose and may allow inward leakage of smaller aerosols. A recent review of the literature suggests that face mask use could result in a large reduction in risk of COVID-19 infection, with stronger associations with N95 or similar masks compared with surgical masks. 17 Even non-professional masks such as homemade cloth masks can provide certain benefits, mainly by reducing transmission from infected persons. Eye protection has also been associated with reduced infection. Improved ventilation in indoor spaces, including public transport and nursing homes, needs to be considered as a preventive measure because it can substantially reduce the airborne time of respiratory droplets and aerosols. 18 Air filtration with common domestic devices, such as portable air cleaners with high-efficiency particulate air (HEPA) filters, can remove small particles of dust or pollen that may act as carriers of SARS-CoV-2. 20 UV air purifiers and ozone-generating air cleaners are unlikely to be effective in suppressing airborne transmission since they need relatively long contact times to inactivate viruses. The effectiveness of air cleaners in limiting airborne transmission of COVID-19 in indoor spaces requires more evaluation. COVID-19 can be transmitted by touching contaminated surfaces and then a mucous membrane, eyes, mouth or nose. A key question is how long SARS-CoV-2 can survive on different surfaces. There is evidence that coronaviruses can remain infectious on inanimate surfaces like metal, glass and plastic at room temperature for up to 9 days, but with progressively decreased infectivity, and for up to 1 day on cardboard and 4 hours on copper. 3, 21, 22 It is plausible that in conditions involving higher temperatures, 30 oC, increased humidity and more sunshine their persistence is shorter. 21 The SARS coronavirus was detected on chairs, elevators and computers in emergency rooms and public areas of hospitals. 23, 24 Extensive surface contamination was detected in a SARS-CoV-2 outbreak center in Singapore. 25 Environmental contamination of frequently touched surfaces in domestic, occupational and healthcare settings, as well as in cruise ships and planes, is therefore a potential route of transmission of COVID-19. These findings suggest that personal objects, such as mobile phones and mugs, that are exposed to respiratory droplets can potentially transmit the virus and should not be shared unless disinfected. Hand hygiene remains critical for reducing the spread of COVID-19. Good hand washing with soap and water is effective, as well as correctly applied sanitizer gel. 26 The effectiveness of disinfection in inactivating the virus using a range of cleaning products on different surfaces can vary. Factors affecting the disinfection process include the type of disinfectant, its dilution, contact time, acidity, alkalinity of the product, air temperature and humidity, and interfering substances. 3 In all cases, the disinfection process should include an initial cleaning step with water and detergent to remove dirt and other organic materials. Human coronaviruses have been associated with diarrhea and other gastrointestinal symptoms. 27 Some coronaviruses can potentially survive in the gastrointestinal tract, and viral shedding via feces has been reported for COVID-19. 1. 28 The SARS coronavirus was shown to survive for at least 4 days in sputum, serum and feces, 3 and also in urine, but with lower infectivity. 29 Detection of another human coronavirus, HKU1, in stool samples from adults and children supports the idea of potential contamination via feces. 30 Therefore, the risk of water or food contaminated with fecal waste should be considered as a potential pathway of transmission. 3, 31 However, foodborne transmission is unlikely when food is properly prepared and cooked, typically at around 70 oC. Importantly, transmission through food consumption did not occur in previous coronavirus outbreaks, SARS and MERS. In the COVID-19 pandemic, there are no reported cases of transmission through food consumption, although transmission through contaminated food packaging may be possible. It is unlikely that chlorinated drinking water will be affected by coronavirus in places with good water treatment infrastructure. SARS-CoV-2 has not been detected in drinking water and based on current evidence the risk to water supplies is low. 32 Nevertheless, laboratory studies have shown that coronavirus could remain infectious in water contaminated with feces for days to weeks. 33 Conventional water treatment methods based on filtration and disinfection, including chlorination and UV light, can effectively inactivate SARS-CoV-2 and other human coronaviruses. preventive measures and implications for public health. Public health approaches to curb the transmission of COVID-19 should continue to focus on testing, case tracing, containment, social distancing and hygiene, particularly in the absence of a new vaccine or specific treatment. 34 The combination of multiple measures, and their timing, have shown to achieve substantial impact on transmission. China enforced drastic public health measures, including widespread testing, extensive individual case and community containment with social distancing, rigorous contact tracing using artificial intelligence, community use of face masks, and early lockdown of the most affected region, with notable success. 1 Early travel restrictions were highly effective in containing the epidemic in Australia. 35 Mandated face covering has also been shown to effectively prevent transmission in heavily affected regions in Italy and New York City. 19 As COVID-19 restrictions are being progressively eased in parts of Australia, the wider use of face masks needs to be considered, particularly in crowded public places where physical distance cannot be maintained. Mass gatherings should be avoided, and home working and distant learning encouraged, as they can bring long-term health and environmental benefits. Increased ventilation with air filtration needs to be considered in indoor environments, such as offices, restaurants and lecture theaters. Rigorous personal, environmental and occupational hygiene, thorough hand washing, good cough and sneeze etiquette, and surface disinfection, as well as physical distancing, should be sustained even beyond the pandemic. A combination of these measures, Table 1, is likely to provide the best long-term protection against COVID-19 and other respiratory infections. A better understanding of SARS-CoV-2 spread and survival will be crucial in characterizing the risk of transmission via different environmental pathways. Susceptibility of the virus to environmental stressors, temperature, humidity, sunlight, and interactions of COVID-19 with underlying chronic diseases, for example cardiorespiratory, diabetes, and environmental exposures, for example air pollution, respiratory allergens, need to be systematically investigated. Now we bring you another study. Relative humidity could play a role in transmission of SARS-CoV-2 indoors. A new study has explored the role of relative humidity in the transmission of the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, from person to person indoors. The study, titled, An Overview on the Role of Relative Humidity in Airborne Transmission of SARS-CoV-2 in Indoor Environments, is published in the latest issue of the journal Aerosol and Air Quality Research. Transmission electron micrograph of a SARS-CoV-2 virus particle, isolated from a patient. Image captured and color enhanced at the NIAID Integrated Research Facility, IRF, in Fort Detrick, Maryland. Credit, NIAID. Highlights of the study. This work is a collaboration between researchers at Leibniz Institute for Tropospheric Research, TROPOS, Leipzig, Germany, and Kaiser National Physical Laboratory, New Delhi, India. The team explored the role of relative humidity, RH, in the aerosol-based transmission of the SARS-CoV-2 virus. The team found that the risk of spread indoors was more significant when it was drier compared to rooms with higher humidity. The optimum humidity for maintaining human health was found to be between 40 and 60%, and it was essential to set standards for RH indoors to prevent transmission of the infection. Dr. Ajit Rawat from Tropos, one of the authors, said, "In aerosol research, it has long been known that air humidity plays a major role. The more humid the air is, the more water adheres to the particles and so they can grow faster. So, we were curious, what studies have already been conducted on this? Airborne transmission of viruses." The team wrote that certain factors could aid in the transmission of the novel coronavirus. These include entry of the virus particles into the indoor environments from the sources of emissions helped by other factors such as relative humidity, wind speed, temperature. They explained that respiratory infections such as COVID-19 disease could spread via aerosols that are of size less than 5 micrometers and viral droplets that are of size between 5 and 10 micrometers. An infected person usually exhales these. While the more significant drops fall to the ground due to their weight, smaller droplets lose mass due to evaporation and remain suspended in the air for more extended periods of time. The team wrote, "Small droplets of radius approximately 5 micrometers will take 9 minutes to reach the ground when produced at the height of 160 centimeters, that is, average speaking height. These droplets," they wrote, "are important in the transmission of SARS-CoV-2. Indoor environments and viral transmission." The team explained that in regions with poor ventilation, there is a recirculation of air within the rooms. They added, in cold and temperate climates, within an indoor environment, the RH values are typically low. Due to dry air and low relative humidity, there is more rapid evaporation, and the larger droplets get converted to smaller droplets that can help transmission of the virus. However, in regions of high humidity, the droplet size of the virus increases. Thus it falls faster, and there is less risk of other people in the vicinity to breathe in the infectious droplets. The team wrote that there could be 3 effects of RH on viral transmission. These include fate of microorganisms inside the viral droplets. The viability of the viruses was low between 33 and 100% RH. Below and above that, the viruses survived longer. Survival or inactivation of the virus on surfaces, lower temperatures and lower humidity prolonged survival of the viruses on the surfaces. Role of dry indoor air in airborne transmission of viruses. At RH lower than 40%, the risk of viral respiratory infections is greater, say studies. Comparing indoor and outdoor RH and COVID-19 risk. This revealed that dry indoors with RH less than 40% raised the risk of airborne transmission of COVID-19. The risk was lowered when RH was raised from 23.33% to 82.67%, said one study. When looking at outdoor humidity, they noted that absolute humidity, had a direct correlation with COVID-19 spread risk. One study showed that 73% of the confirmed cases were from regions with in the range 3 to 10 grams m3. Conclusions. Dr. Ajit Lawat summarized the findings saying, if the relative humidity of indoor air is below 40%, the particles emitted by infected people absorb less water, remain lighter, fly further through the room and are more likely to be inhaled by healthy people. In addition, dry air also makes the mucous membranes in our noses dry and more permeable to viruses. Professor Alfred Weidenstiller of Tropos added, heating the fresh air also ensures that it dries. In cold and temperate climate zones, therefore, the indoor climate is usually very dry during the heating season. This could encourage the spread of coronaviruses. Dr. Sumit Kumar Mishra of XR, National Physical Laboratory in New Delhi said, a humidity level of at least 40% in public buildings and local transport would therefore not only reduce the effects of COVID-19, but also of other viral diseases such as seasonal flu. Authorities should include the humidity factor in future indoor guidelines. Recommendations. The team wrote that there are no policies yet to regulate the temperature and RH indoors to prevent transmission of SARS-CoV-2. They recommended, based on research findings, for future scenarios, setting a minimum RH standard of 40% for public buildings will not only reduce the impact of COVID-19, but it will also reduce the impact of further viral outbreaks, both seasonal and novel. They also emphasized other measures of infection control such as increasing natural ventilation using open windows, the use of face masks and shields, and avoiding close contact of persons infected with the virus. Thank you for watching. Please subscribe and share videos. See you in the next video.